Hello everyone, it's Dr. Nicole Klersy-Mohr here. I'm just coming back online another day to say hello, to talk about a few things that many of us maybe avoid talking about, right? So going into a new doctor for the first time is scary. There are a lot of questions. So whether you're going to get a massage, get an adjustment, whether you have a chronic disease or an acute symptom, it can be scary. And so finding a doctor is important that specializes in the area that you need care for, but it's also important that they can be trusted. So a lot of people will go on Google and search things up because they just want a massage. Some people will go on Google because they want to find a place like The Joint and just get adjusted. Those are simple, right? But for some of us, like, I get really wary of who's going to be touching me or handling my case and their intent and their skill set and all those things. So the best way to get a referral is to ask a friend. Talk to your family members in the area, your friends in the area, your coworkers in the area. Ask them about why they went to that doctor, what the doctor did, what the treatment was. There's so many different things that you could do. The best way to get a referral is ask somebody. Because you may be like, well, they look good. They specialize in XYZ. Oh, they have 4.7 star on Google and all these things. But in our day and age, that can mean a lot of different things. Just because you have a 5-star review doesn't mean that they might be a good fit for you or do what you want them to do. For example, my back hurts. I think it's muscular. However, I need somebody to diagnose what that might be because I can't walk or it's really hard to sit, right? So we're going through all these things and you go to a regular chiropractor and you saw them on Google and now they made you worse and you didn't get any answers and you swear chiropractors off for good. Same thing with massage. Same thing with surgeries. A lot of times you hear that with surgeries. Oh, I would never get my hip replaced from that doctor again. Blah, blah, blah. This is why. So getting a referral is kind of a finesse. You want to do it prior to having an injury. You want to vet to people, like some of the people out a little bit just to see, like, are they a good fit? I'm a chiropractor. I'm a doctor. I do massage therapy. But my treatment style is going to reflect my philosophy on that the body can heal itself, less is more. I want to educate you so that you don't have this thing going on and 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 on, so that we can fix it. I can give you homework at home, or like we talked about last week, if you want to come and see me and pay me a bunch of money all the time and have me work on you and get things moving, I'd have to see you more often if you do nothing at home. I'd see you less often if you did more at home. Therefore, the price of seeing me varies per case, per patient, per outcome. So you want a referral that's going to fit your personality, right? That's probably the bedside manner you talk about. You want somebody who's either going to be serious and kind, or just kind, hold your hand, whatever that is, in whatever season you're in, that's going to be one aspect of it. The other aspect is going to be knowledge. Are they going to fit the ability to answer your questions? Are they going to give you a multitude of if-thens? This is your herniated disc. If you got adjusted 3 times a week for 12 weeks, this is what would happen. If you did nothing, this is what would happen. If you did PT, this is what would happen. If you did surgery, on and on and on and on and on. You want somebody who can give you that if it matters to you. Sometimes that doesn't matter. So there's a lot of things that you have to kind of weigh out when you're going to ask for a referral. When you ask your friend, you can say, hey, Susie. I don't know who Susie is. I'm just saying Susie. I have plantar fasciitis, and my feet have been hurting so bad. I've seen XYZ specialists, and they said it's not, nothing they can do, wear a boot, and they give me but I need some relief. Do you know a massage therapist or PT or chiropractor that might help manage this in a way that I can improve it? I really want to get to the root issue of why my plantar fasciitis is so bad. And Susie might say, I wouldn't go here, and I wouldn't go here because I tried them and this is why. But let me ask a few other friends because I know a couple that had plantar fasciitis. And so she calls you back and says, actually, 2 of my friends said, if you go to Dr. Hufflepuff, on Hogwarts, this doctor is the miracle worker. They educate you. They have a really good bedside manner. Everything about them is upfront. Here's their number. That is one of the best organic ways to get a doctor who might fit you. So you look at bedside manner, you look at the knowledge that they carry, the ability to extend the knowledge to you. So you got to look at time constraints, kind of how the overview of their clinic is set up. So is it a big clinic where they have triage nurses, ER, all of the hospital stuff, and then have a side clinic where it's doctors and nurses and phlebotomists and all of that, and they're on a schedule and they're super busy and this is how it is, and you love that, then go there. If you want a little bit more time, then you're going to try to hit a private practice, right? So a chiropractor might be the fit, or a private practice MD, a PT, right? There's a lot of doctor of physical therapy out there. There's a difference between the schooling and the philosophy, but you have to know, if you go to a surgeon, you're going to usually get surgery. If you go to a chiropractor, you're usually going to get adjusted. If you go to a naturopath, you're usually going to get a lot of herbs and supplementation. If you go to a construction worker, a deck builder, you're going to get a deck. There's so many things out there that if you're seeking that type of care, you're going to get that type of care. And what I mean by that is you kind of have to vet the doctors on how they treat and go backwards into what clinic they work at. So for example, me, I am a primary care physician, chiropractor, massage therapist who has training in neurology and functional medicine. I'm going to tend to have more time. I'm going to collect more data. A lot of people get annoyed if they don't know that's going to happen, because I need to know to get the right diagnosis, to get the right treatment plan, to get the right outcome that you, the patient, desires. So for me, I annoy some people. I take too much time. I ask too many questions. Can you just adjust me and get me out of here? So eventually, maybe I'll get there. It depends on your case. And for a lot of patients who've seen me for a long time, I do get there when they're like, yes, it's not a big deal. There's nothing changed. I just need a tune-up. Bam, bam, we adjust you. Massage, massage, we massage you. Not a big deal. But until we get a handle on how chronic is your disease, what outcome you really desire, all those things, my job is to present to my patient all the options. So what option fits you best at this time? Some people, they're like, hey, that's amazing. Some people are like, can you just choose for me? I'm not that kind of doctor, although a lot of doctors will. This is what's best, this is what you should do, blah, 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 right? So Find somebody you trust. Ask them, how do I get to XYZ? And really hone into the end experience, like what types of treatment and outcome happened from this doctor. And that way it'll show you, is the time investment worth it? It does or it doesn't fit with you and your moral standing and your way that you think through how healthcare should be. Does it hit the financial mark? Some are more expensive, but maybe you get more time and more data. Some are less expensive. For example, the joint. Amazing. A lot of people get a lot of benefits from going to Massage Envy, the joint, right? All these minute clinic type things, because you're in, you have an answer, you got pink eye, you need adjustment, you got, need relaxation on vacation. You just get in and you get going. And that's cool. But for those of us who really want a practitioner or a physician or a massage therapist or a chiropractor who has an assessment to get to an outcome to make us healthy, that's going to be really, really hard to get to Googling. You can watch so many different Google reviews or Google ads or Google this or Google that. I mean, you got Facebook and I don't know, everybody's going to make fun of me. I am not that old, but I don't even know the platforms. By the way, get off social media. Anyways, that's a side rant. When you get a referral, make sure it's a good fit for you, because then it'll be worth every minute you spend with them. Your health will benefit from everything. Your relationships will benefit. Your ability to work will increase, or ability to enjoy retirement, ability to enjoy life again. If you get a good doctor that can actually give you the information, you can regurgitate, decide on your own health care, that's going to give you the best outcome. So referrals are important. Make sure that you ask the right questions and make sure you see the right physician, because there's nothing worse than having a doctor and a patient not fit. Unless you're amputating a leg, you don't really choose an ER doc. You're just hopeful that they have the staff and the anesthetics. But when it comes to your health, when it's wellness or preventative or maintenance, you're going to want to really find what works for you. So find that doctor, find that therapist, find a good referral source, and make sure on the other end too, talk about these things. My doctor does XYZ. You should check them out. Here's their number. I know that, they're not like most chiropractors, or I understand that a chiropractor might not seem like they do this, but Dr. Nicole does, or Dr. Susie, or whomever it might be, because that referral is going to get the patient hooked up with the doctor. The doctor is going to be able to help the patient, and everybody is going to gain health and enjoy that time. And that's what really, really, really bonds a general practitioner or any other physician to their patient, is the ability to make the right connections, to make sure that we are on the same page and we want the same thing, which is health for the patient and answers for the patient. So it's been really nice talking to you guys. I hope to continue to kind of just go through the nitty-gritty. There's a lot of the back-end stuff that we might address here. Insurance might be one of them, and then other disease sources, right? So we might get into some of those things. As I get rolling and as questions start coming in, I will definitely start doing 5 to 10 minutes, maybe even a little bit longer, with resources and research papers connected to these things, so that you can read on your own or get connected on your own. Anyways, have a wonderful day. I hope that this greets you well, and I hope to talk soon. Goodbye.